Okay.
All right, well, welcome. This is our first Facebook Live post. My name is Dr. Danae Eby. I'm a physical therapist here at Bel Air PT, and this is
Abby.
She is a tech, and also she works up front to help us with administrative things. So basically today, reason for why we're doing this is we want to provide care to the patients who can't come in to us now at this time due to COVID-19 or coronavirus. So we just want to give y'all something to do at home and maybe some education here. So today I would like to talk about maybe some rotator cuff issues or just in general, just shoulder pain. These, just keep in mind, these are just all general recommendations. We'll go over like signs, symptoms, maybe some of the causes, what we can do to help the pain with some exercises and all that you can do at home since you can't come in, or if you're not able to come in, you can do those. So if you do, just keep in mind that if you perform these exercises at home, you're doing that at your own discretion. If you have any concerns or if these exercises cause any pain and you want more specific exercises more geared towards your shoulder, definitely schedule an evaluation with us, or maybe we can even do a virtual visit with telemedicine. We're trying to work on getting that up pretty soon for you guys. So basically, shoulder pain. I'm going to go ahead and pick this up and bear with us as we go through this together. How do I turn it around?
Right there.
Okay. All right. Hi, Abby. So you're having shoulder pain, right?
Right.
Okay, so let's say your left shoulder is hurting. So a lot of the signs and symptoms that you'll have with this, with a rotator cuff, you're going to have some lateral shoulder pain right in there, especially with overhead reaching behind you or across your body. So some of the symptoms, there's pain in the shoulder. You may have it go down your shoulder, or it may just be localized right there. So first things first, go ahead and raise your arm up overhead for me. So a lot of times patients may not have full range of motion, or they have pain at the end range. And whenever their arm's out to the side like so, Abby, copy, all the way down like this, copy me. So as you raise your arm up, you're going to have a painful arc. So it's going to hurt there, all the way up, and then to there, and then as you go all the way up, it may go away. That's signs of a rotator cuff issue. Some other things, Abby, follow me. This may create pain going in this way, or you may have pain reaching back behind you, like reaching behind you to grab something out of your back seat in your car. So those are some signs and symptoms. It also may hurt whenever you're lifting something heavy or whenever you sleep on that side at night. Okay, so some things that we can do. A lot of this has to do with positioning, basically just how the shoulder blade is positioned, and we'll go over that maybe in some future videos. So let's go over some exercises right now. So Abby, go ahead and lay on your side facing away, because we're working on your left shoulder. All right, let's come around. So some exercises is on your side. I'm going to turn this around, or keep it like this for right now, just because y'all can't turn your computers. Okay, so whenever you're at home, try to get like a little towel roll. So let's get you a towel roll right now. Coming over. Okay. All right, roll that up for me. Now, we need to work on your rotator cuff. So we're going to put this underneath your elbow right in there while you're lying on your side. This way, it opens up your shoulder a little bit more so that everything's not so compressed. So now, just follow me. You want to make sure that you kind of position your arm back a little bit. So what I'm saying there is you want to make sure your shoulder is in a proper position. You can't work the rotator cuff well if it's face forward so much. So she's going to make sure she places her humerus, this arm bone right here, back into where it needs to be. So she's going to push it back just slightly. Good. She's going to keep that there, shoulder blade flush against the spine. And then she's just going to very gently raise the arm up all the way, pain-free. And she can hold that there. Now, if you're at home and you don't have a weight, a can of beans is like a pound. Maybe a water bottle, a metal water bottle full of water could be about 2 pounds or so. Just do what you can. That doesn't create any pain. So she's going to hold that for about 5 to 10 seconds and then right back down. All the while she's keeping this back where it needs to be. She's not letting it pull forward. Good. Do it one more time. Good. You can do that. Now, if that range hurts, you can always keep it and hold that right there with your weight. So that's one exercise. Now, let's go over some exercises you can do for your shoulder blade. This one's pretty simple. We're going to go on your stomach. Now, there's a lot of muscles in the back. Go ahead and put your arms by your side. There's a lot of muscles in your back around your shoulder blade that helps kind of set your shoulder up so that you can raise your arm with proper biomechanics so that there's less pinching of the rotator cuff. So right in this general area is your mid traps. Right in here is your low traps. And you have your upper traps, and then you have the rotator cuff. Those are the main muscles. Oh, I forgot one. And your serratus. We'll go over those a little bit later. So a general one, just kind of, since we all sit in the chair and we all have that forward shoulders posture, that's very, very bad, will create shoulder pain in the future. We're going to just do a general exercise to get everything back. So she's going to lie on her stomach. Let me get back a little more. Palms are down on the table. Good. And she's going to pull her shoulder blades up and back and then lift her shoulders off the table, squeezing her shoulder blades together so it looks like this where everything comes back. And she's holding it, and she should feel it right around here. Make sure you're not shrugging up. Very beautiful. Very good. Okay, Abby, where are you feeling that?
Upper, middle, back.
Very good. So if that's really easy, what she can do is she can lift her hands very little, just to her hips. So lift your hands up just right there where they're just hovering a little bit, just so you can get a little bit more longer lever to make it a little bit harder. Okay, let's go over one more exercise. So go ahead and stand up. So far we've worked on a little bit of her rotator cuff and a little bit of her shoulder blade muscles. Now let's come to the wall, and we're going to do this exercise called wall slides. I need to go the other side. So these wall slides are really good because they work on your serratus muscle, which is right about here, and your upper traps, and just shows your shoulder how to move appropriately as you raise your arm up. So while she's here, she's going to keep her chin tucked. She is going to push her body away from her elbows. Good. See how her shoulders came forward, but her elbows stayed here. Very nice. That's activating the serratus, so you should feel it right in here. Now, she's going to slowly slide her arms up. Keep going. Keep going. You're going to lean into the wall a little bit. Once you get right there, you're going to slowly shrug your shoulders up so you're reaching towards the sky. Abby, keep your core tight so you're not arching your back so much. Beautiful. And then you should feel it right up in here because you're working on your upper traps. And then reverse it. So you're going to slowly lower your shoulders, and then you're still going to push back, push back, push back. Good. Pretty good. And that will help show your shoulder how to move appropriately. Now, if you're having pain, and any time, especially at the end range there, you don't have to go that high. Just go as much as you can without your pain. All right, beautiful work. Okay, so thank you. That was wonderful. So if you have any questions, just give us a call. Ooh, that's horrible lighting. There we go. If you have any questions, just give us a call. We can go over maybe a little bit more specifics if you schedule maybe a virtual visit, or if you're brave enough, come on in. But depending upon what's going on, we're here to help. All right?
Thanks, guys.
Thanks.